Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs. Brought to you by LucidQuest. Australia has launched the largest randomized controlled trial exploring whether a low-plastic lifestyle can improve cardiometabolic health. 60 adults were randomized to either 4 weeks of plastic-free living or a control group. Outcomes include urinary bisphenol and phthalate levels, blood pressure, body composition, and gut microbiome changes. If effective, this trial could reshape future public health recommendations. In China, scientists have transplanted a genetically modified pig lung into a brain-dead human. The lung functioned for 9 days before immune rejection occurred. While immune barriers remain, this breakthrough represents a major advance in xenotransplantation and could offer critical insights into addressing global organ shortages. In the United States, a case series involving 19 patients, mostly infants, has shown that donor valve transplants used in partial heart transplants grow with the child. This reduces the need for repeated surgeries compared to artificial valves. Risks include the need for lifelong immunosuppression, but outcomes appear promising. Experts view this as a supplement, not a replacement for pediatric heart care. A brain imaging study has revealed that the hand representation in the brain remains stable even years after amputation. This challenges the long-standing belief in cortical reorganization. The finding explains phantom limb sensations and provides new insights for prosthetic development. It also suggests that therapies aimed at reversing reorganization may be less effective than previously thought. A 6-year clinical trial involving 4,746 participants has found that combining Mediterranean diet with lifestyle changes reduced the risk of type 2 diabetes by 31%. The intervention included calorie restriction, exercise, and weight loss guidance alongside the diet. Participants achieved greater weight and waist reduction compared to diet alone. This provides high-level evidence for public health prevention models. A study involving 124 patients has found that cannabis use improved insomnia, as well as symptoms of anxiety, depression, and pain. The benefits lasted up to 18 months, and side effects were mild. The findings suggest cannabis could be a long-term therapy when other medications fail. However, randomized controlled trials are still needed to confirm safety and efficacy. A trial published in The Lancet Rheumatology has shown that gait retraining by adjusting foot angle reduces knee pain in osteoarthritis patients. The method lowers joint stress without the need for drugs or surgery. MRI scans confirmed slower cartilage deterioration. Wearable technology could help deliver this approach directly in clinics or even at home. Researchers at the University of Southern California have developed a cerebrovascular dynamics index, a tool that measures blood flow regulation in the brain. This outperformed amyloid PET scans and cognitive testing in early detection of Alzheimer's disease. The findings shift focus from amyloid plaques toward vascular dysfunction. They also suggest that interventions such as exercise and diet could help restore brain health. High ventilation breathwork, lasting 20 to 30 minutes with music, has been shown to mimic the effects of psychedelic therapy. Participants reported experiences of bliss, unity, and emotional release. MRI scans revealed activation of the amygdala and hippocampus. This offers a promising non-drug approach for mood regulation and trauma treatment. Finally, researchers at Kyoto University have developed a painkiller as strong as fentanyl, but without addictive risks. The drug works by enhancing the body's natural noradrenaline pain suppression. Early human trials demonstrated morphine-level relief without sedation or dependence. Phase 2 trials are now underway in the United States, and approval could be possible within 2 years. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.